So total body photography is generally something that we recommend for people who are a little bit higher risk as far as their risk for melanoma in the future goes. So the most important part of sort of finding skin cancers and melanoma is a full skin check, but for people who have risk factors that make them sort of more likely to develop melanoma, it is something that can be added on, which essentially there's some good evidence behind it that for people who have total body photography done, the chances of us picking up a melanoma earlier are higher, which is great. And also, quite significantly, the chances of us needing to cut something out that comes back benign are also much lower, which means you can save the needles and the costs and the scars that are associated with it. So people who, as a general rule, people who've had a previous history of melanoma are great candidates. People who have a family history of melanoma should be considered. People who just have a large number of moles on their body which are hard to keep track of is important as well as people who have had sort of non-melanoma skin cancers in the past, or people who just have quite light skin with a really high tendency to burn. So those are probably some broad categories, but sort of depending on individual people and their other risk factors, what they do for work, it can sort of swap and change a little bit, but it's worthwhile to have a chat with your skin cancer doctor about whether that's for you or not. So if you're a high risk patient, and through our centre here at the Sunshine Coast, if you book in as a high risk patient online or through the telephone, you'll automatically be sort of lined up for total body photography. So that'll be done before your skin check. And the process of total body photography is essentially having you undress to your underwear or whatever you're comfortable to undress to, and basically using a few sort of predetermined poses and the sort of photo finder total body photography unit, we get sort of 50 megapixel high definition images in that way, which are all there ready to go by the time you see your doctor straight away afterwards. The other way that you get booked onto the total body photography is if you've just booked in for a regular skin check, and then we determine that for some reason, whether it's your history or your family history or what you do for work or some characteristics of your skin, that you're high risk for melanoma, we might recommend that you have total body photography done. So that can either be done the same day if we have availability, or booked in for the next day, the next week, so we have that baseline sort of moving forwards for the rest of your life essentially. The total body photography itself is sort of an adjunct which allows us to be a little bit more accurate. So having that done on its own doesn't provide you with a lot, but having that done in conjunction with your full check with your skin cancer doctor is what really gives us the ability to find things as early as possible and to avoid subjecting people to procedures that they don't need as well.